All right. Well, we are live and welcome to another Real Talk Tuesday. Uh, I know that we have kind of been on a bit of a trend here with having caregivers join us to kind of share their experiences. And we've been really connecting caregivers across the spectrum. Since it is American Heart Month, I thought it would be great to highlight a caregiver who has a little bit of experience, perhaps, in that space. And so I could not think of anyone better to bring on than CAN's very own Jodi Koehn-Pike. Hi, Jodi. How are you?
Thank you for having me on. I'm excited to share my story, as weird as it is.
Yes. So I know that you have been on previously and you've talked a little bit about your caregiving, specifically as it relates to your parents.
Mhm.
But this is about caring for your spouse. So I don't know if you want to lay a little bit of the foundation here.
Sure. It was a very weird story. My husband had been having dizzy spells, so he went to the doctor thinking, oh, he's got an ear infection or who knows what. I was out of town, and the doctor had sent him to the ER to get a CT scan just because he could get it right away, as opposed to jumping through all the hoops. I get a call. Hi, this is Dr. Whatever. I'm a cardiologist at Suburban Hospital. I just read your husband's MRI and he's had several microstrokes. And I'm in a different time zone. So I like quick get on a plane. It turns out he had had an infection that settled on one of his heart valves and they were referring to it as vegetation. So every time the heart valve moved, little pieces would break off, went to his brain. This was causing the microstrokes. So he's in cardiac ICU for a week. They decide to do surgery to figure it. They thought they were going to have to replace the heart valve. So it was debating, are we going to keep him here? They ended up sending him to Baltimore to Johns Hopkins University, which in this area, if you're going to have major surgery, that's the best place to be. So they did the surgery, and it turns out they didn't have to replace the valve. They were able to just clean it out. But yeah, they referred to it as vegetation. So he was there at Hopkins for a week on massive, massive amounts of IV antibiotics since this all started with the infection. So it was like, 2 hour each way trips to Baltimore. And then once he was released, he was on antibiotics 4 times a day for 6 weeks, and I was doing the IVs. So it turns out they didn't really need to do anything to his heart per se, but he still had open heart surgery. So he's got the big scar. He had the rehab. We had all these follow-up visits. And now he has to be on antibiotics prophylactically whenever he goes to the dentist or has anything done.
Right.
So it was an interesting, odd journey. So he's okay, but he's never going to be completely back to normal because he just needs to be careful.
Right. And I think that that's something that's really interesting. And why I wanted to highlight, I think, kind of your story is that when we think about caring for someone with, um, within that kind of that spectrum of heart conditions, we're usually thinking about someone who has had a heart attack
Mhm.
or is in heart failure. But it really is a large spectrum
Yeah.
of both conditions that impact your heart, but cardiac events, like what you were
Mhm.
um, describing. And I think I've shared here before, like I am a cardiac patient. I had a coarctation as a baby, a congenital heart defect was repaired, and then I had a valve replacement just a handful of years ago. So I'm also part of the Zipper Club as well. So um, now you talked a little bit about that journey, being in the hospital. What went so and you kind of went into this a little bit. How did you feel when you got that call and it was like, hey, this is a cardiologist. This is this is where your
Mhm.
husband's at. This is what we're going to be doing.
I freaked out. I was in Chicago. So I was with a friend on a girls' trip. I immediately got on the phone to Southwest Airlines, said, my husband had a stroke. I have to get home right now. So and I ended up getting home, like at 2 o'clock in the morning, but I was home.
Mm.
And then went back the next day. And it was just, and at the same time, there's all this stuff happening. His dad was in the hospital and his mom didn't want to scare his dad. So she wasn't telling him. So she couldn't come with. It was just this whole all the stuff was going on. But yeah, the whole vegetation thing was kind of creepy. And the heart surgeon, during when the surgery was over, came out and told me, yeah, everything's fine. We were able to scrape it all out. And it looked like broccoli, which
Ew.
is interesting.
Yeah.
It's
So that's an interesting thing, though, and this is something that we haven't really talked too in depth about, I think, in any of our real talks, which is okay, so this is a cardiac event. This is caregiving kind of on the fly, where you're kind of dealing in with a emergency scenario, which is definitely something that a lot of people have to navigate, right? Our loved one is in the hospital. We have to take them to the emergency room. They have some kind of medical event, and we are completely lost at sea as caregivers to figure out, like, okay, well, what are the words that you're speaking? What is the condition? So were you comfortable being kind of in that space and saying, hey, I like, what do you mean by vegetative? What do you mean by these words? And what does that translate into what's next?
mhm. I started out freaked out, obviously, because that was just the first response. Um, it was, I asked a lot of questions, and I have an interest in medicine to begin with. So a lot of the stuff that they were telling me, I understood what they were saying, which would not be the case for a lot of people. And I was lucky that before they transferred him by ambulance to Hopkins, they were letting me sit on rounds every morning. So I could
Wow.
hear the doctors and everybody and the nurses and everybody discussing his progress in his case and all that, which I didn't expect them to let me do. And it was really cool because I, kind of got to see behind the curtain of what was really going on. Because he doesn't, if I'd asked him questions, he wouldn't, it just wouldn't stuck in his head what exactly they were doing. Because I
Yeah.
mean, obviously he was more freaked out than I was because it was him.
Sure. No, and I think that's the other thing. I mean, that's the other side of that very coin, which is yes, as a caregiver, you need to understand what's being
Mhm.
said, but you also will more times than not have to translate that for your loved one and kind of boil it down to say, okay, well, this is what they're talking about, and this is what we have to do
Mhm.
as next steps. Um, Thank you for sharing that because I think that that's something that as caregivers we just feel really under prepared to navigate when we talk about working with the healthcare team. It's one thing when
Yeah.
we're going into those standard uh, doctor's appointments or even specialist
Right.
appointments. If we're kind of warmed up to it, we kind of can navigate it a little bit smoother. But
Mhm.
when it is an emergency situation and it's brand new on top of that,
Yeah.
I'm sure it feels pretty overwhelming.
Mhm. And as you know, I had a whole little office set up in his hospital room
Yes.
so I could keep working, but be there and be listening and everything. It was.
what was that like for you as a caregiver, having to be there and supporting your husband, but then also trying to balance work?
It was hard, especially days when I'd have, back to back, like phone meetings and said I had my headphones on. I had my whole little used one of their little cart things, had my laptop set up and had a whole little office. And then a doctor would come in, I'd be like, okay, turn that off, listen. So it was a challenge, but it's also something that it's a reality.
So this is a little bit of an awkward question to ask just because you work at Caregiver Action Network.
Mhm.
We work pretty closely together on our team. And so I kind of know a little bit about this, but kind of stepping outside of coming to the table with, the what maybe you've garnered or learned from CAN, balancing work and caregiving in that situation. What was like what were some of the steps for that? Like what did you kind of have to do to get that set up? And did you hit any um hurdles along the way? Like you said, you had to set up like a little um office space at the
Mhm.
hospital. Um, were there any challenges in kind of bringing that all together?
I was lucky, I mean, given where we work, if we don't understand what a caregiver is going through, nobody's going to understand it. So I was really lucky to work somewhere where it was, you know, extremely supportive. Everyone's like, you don't have to be on this meeting. And it was just that I didn't run into problems that I think a lot of people would have run into. Their boss doesn't understand. They can't work from home, just things like that. So I was really, really lucky. But one funny thing was when we were at Hopkins, I was reading this pamphlet that they had handed out, and I'm
Mhm.
reading through it, and I'm like, this sounds really familiar. They had directly quoted our 10 tips for family caregivers.
And there you go.
Yeah,
If you need that verification check
yeah.
that the resources that you have are solid, that I remember you sharing that with the
Uh-huh.
staff and
I
saying,
was like, this
"Hey,
sounded really
it's
familiar. And then I looked, I'm like, yep, that's because it's ours.
exactly." And as the person who really spearheads all of our content development, um, if there's one person that I would expect to really have their spidey senses tingling whenever they see something that is canned content, you would be the person to be like,
Yeah.
these words sound very familiar. Like I have used these words very often.
Yeah.
Um, so we talked a little bit about the hospital. What about at home?
At home, it was when he came home, like he was able to walk around stuff, but just got, tired really quickly. But we had to do three IV pushes a day at specific times. And then he also had a IV pump that we had to do at a specific time. So even though we were home, I was, I still wasn't really able to leave the house for more than, like 15 minutes at a time.
Yeah.
And I had to be there just to be there to help him walk upstairs and all that. So it was, so even even once you're out of the hospital, you're not out of the situation.
Yeah. No, I think that that's another aspect. And I know that that's something that we've talked a lot about kind of internally at CAN. And I know that some of our resources, one, which I'll highlight before we kind of close things down, is that, when your loved one gets discharged from the hospital and is at home, you're kind of starting from a different square one of,
Mhm.
okay, now I'm in charge of doing this. Now we have to figure out how we're going to get X, Y, and Z done, because this is additional care that they may need. And what you're talking about may be something that a caregiver may feel really uncomfortable doing, like having to administer those IV medications and, things like that. Did you feel supported, um, as you were going through that discharge process of like, okay, so I understand what I have to do at home, um, but how do I do it? Like, what is teach me.
Yeah. I did feel supportive when as soon as he was discharged, we went to a facility that we had to go back to once a week because that's where we got the IVs. And they made sure, I knew how to work the pump and everything. But as far as the IV pushes, I just did it.
Yeah.
I mean, they, described, wipe this off and then do this. And he had a pick line in is how he was getting the IVs and all that. So I did feel supportive and they were like, oh, if you have any questions ever, call us. But it was, we had to keep going back up there, back up to Baltimore. And it was so funny because the first time we were in the car and it was horrible, horrible traffic. And Greg was just like, oh, this is really rough. It's hard. And I just looked at him like, yeah. And I did it for a week,
Yeah. Yeah. No, absolutely. And again, it's just one of those things that a lot of people don't necessarily put on that checklist of things when balancing your caregiving plus really anything. But, we often talk about balancing work and caregiving, you know, having to take those trips. Because you talked about, you know, uh, having having your husband's care at John Hopkins. That's not in your backyard. Um,
No.
it's a
It's an
trip.
hour-long trip on a good day, which was usually more like close to 2 hours each way.
Yeah. Yeah. Um, no, I really appreciate you, I think, sharing a little bit about your experience because I think a lot of what you talk about is something that a lot of caregivers can relate to in terms of, oh no, this is something new that we have to do, and I don't know where to go. I don't know where to start. I don't know what questions to ask, and you just kind of have to do it, push through
Yeah.
sometimes. Um, was there any resource or anything that helped you as kind of like for anyone who may be listening to this, was there something that really kind of came in and gave you a little bit of that extra guidance? I know this feels a little bit like cheating because, again, we work for Caregiver Action Network, but
Mhm.
was there something that you were like, okay, I know this resource and I feel this path is a little bit smoother now?
Mhm. There was one of the nurses that was dealing with him that we saw every day. He was the day nurse was so great. He would, go into every time he came in, he would really explain what he was doing. He would explain, this is when we were at Hopkins, he would explain, okay, this is what's been happening. This is what we think. Just, kind of giving me sort of background information that I wasn't getting otherwise. And
Yeah.
and then was just there for any questions. And he would actually say, and actually, a lot of the nurses would be like, how are you doing? Is there anything I can get for you? Which was, yeah, just kind of like really appreciated, but sort of mind blowing. I'm like, I'm not the one in the hospital, but they still wanted to make sure that I was doing okay, which is wonderful.
Yeah, and I'm so glad that you mentioned that because that is something that not that it's not something that happens all the time.
Right.
Um, and so it, you know, I think that this may be, if there's like a pro tip, and I know that we talk a lot about this, and I think it's kind of reflected in those 10 tips, which is ask questions, speak
Mhm.
up. You don't have to wait for the invitation because that invitation may not come to ask those questions or they may not check in, but you have the ability to raise your hand and say, hey, I have a question about what's going on. I have a question about this test.
Mhm.
The doctor came in and said that, we are going to be doing this, and I don't know what that really is. So can you tell me what that's going to look like?
Mhm.
Um, so I think I'm sure when you have people in the hospital that are kind of creating that open space for you, that's got to be a little bit more reassuring to raise your hand and say, okay, what's going on? What does this mean? What
Yeah,
are we
yeah,
doing?
I never felt like, oh, maybe I should know the answer to this question. Is it stupid to ask? Should I even ask this? Do I interrupt? I don't want to bother them. I never felt that from anybody there. They were all very, open and encouraging and supportive.
Yeah,
So I know that this doesn't happen everywhere. So I was really fortunate.
that's great. Um, Jodi, again, thank you so much for sharing. I think that this is such an important, piece of what we do in terms of, we always like to come to the table and say, not only do we work at CAN, but we have our own caregiving ties. We have our own
Mhm.
caregiving experiences. And it really does, I think, help us have that different level of understanding sometimes when we're talking about what resources are needed. So,
Mhm.
maybe we're creating a resource that is cancer related, and someone on the staff can raise their hand and say, oh, well, I'm caring for my spouse with this cancer. And this has been a little bit of my experience. And so that's just another level that we're able to kind of infuse. And we never want to neglect that, because one of the things that we always say is that caregivers want to learn from other caregivers.
Right.
So I think that's an important piece. Now, because you are, the person who really streamlines and puts together in a lovely fashion our resources as part of our comms team. One of the resources I want to make sure to mention, and I'm going to share my screen real quick. This is why I'm so glad, y'all, that we switched over to Zoom, because now I can do this. And isn't that an exciting adventure for us? All right. So I think you'll be seeing my screen here in just a second. Let's see.
Yeah. So
Okay, there we go. Um, so yes, this is our heart failure caregiver navigator. So one of the things, and this is something that lots of caregivers can relate to, but something that was really, I think, important in conversations that we were having around heart failure and some of those related cardiac conditions is, what to expect. What does the caregiving journey look like? It can be very, very scary when you hear those words, heart failure. It can be really scary when you hear the word any kind of failure, whether it's liver failure, kidney failure. It's a very scary place to be. And having a little bit of support and knowledge about what some of that caregiving journey may look like can make a huge difference in alleviating at least a little smidge of that concern and worry and fear. And so the heart failure caregiver navigator, and this is one of the first tools that we set up in this kind of format. Um, like I said, kind of walks you through what that caregiving path may look like. So, where you start, what happens when you get that diagnosis, understanding what your role as a caregiver may look like, how you're starting to track some of that medical information, being prepared when you have to take those unexpected ER visits, and self care. Um, as the caregiver. one of the things that you mentioned that I think is also a very important piece and something that I think is really, I think a good flag, as you know, we continue to develop resources, um, is what does that ongoing care look like? Because ongoing care is certainly something that can happen, where you're going to have to go and have, you know, check-ins every so often, or a part of your routine will have to change. And so being able to kind of incorporate that into a new normal, I think is something that, you know, when we look at resources, I think is another little piece that is a good thing to infuse. Um, so yes, I will put in the comments of this the link to the heart failure caregiver navigator, so that if you're interested in checking it out, please do. We're going to be putting together a couple of additional resources kind of in this space as well. Um, I know that both Jody and I have been working on one related to ATTR. So that will be coming down the pike uh, soon. So thank you, Jody, for being here. Thank you to the Facebook community. For always being, I think, warm, gracious, and just a really great spot for folks to come in and share your story. If you are a caregiver of someone who is navigating a cardiac condition, um, sound off in the comments. What has your journey looked like? What are some resources that have really been there to support you? Where are there still gaps that you may come up against as you're looking for those additional resources and support? You know, keep that conversation going. We always like to be able to see how some of these conversations can continue to develop. So, thank you all for being here for another Real Talk Tuesday, and I'll see you all in the group.